Good morning, everyone. Today we're going to talk about depression or major depressive disorder. So to start our presentation, I would like to talk about the definition of depression. Depression is one of the mood disorder. We have so many mood disorder like bipolar, dysthymia, cyclothymia, and depression is one of them. So depression is persistent feeling of sadness and loss of interest. This is the main definition of depression. Some people like to call it major depression, others like to call it major depressive disorder or clinical depression. But most of people, or in the medical field, when you get a diagnosis of depression, doctors call it major depressive disorder. And as I told you, depression is very common, and the prevalence of depression is around 12%. Interestingly, it is more in female than males. So, and a lot of people ask why more in females. There is two explanations. Some studies say, oh, it is not more in female or anything, it is just equal, but a lot of female seek help more than male. It is easy for female to talk about their feeling and their emotion than males. And some studies say, no, it is more common in female because of hormonal difference between female and males. Maybe because of menstrual period or something like that. So it doesn't matter, but I want to show you that depression is very common and the prevalence in general is 12%. So we will talk now about the diagnosis of depression. To diagnose any mental health disorder, we need this DSM. DSM is a manual for diagnosis of all mental health issues because this book has all the symptoms of mental health disorders. And for depression, you need 5 symptoms of depression to get the diagnosis of depression. And actually, depression has 9 symptoms. Okay, if you have 5 out of 9, you can get the diagnosis of depression. And what are the symptoms of depression? So I'm gonna explain all the symptoms. As I told you, it is 9. They are 9 different symptoms. The main symptoms are the first one and second one. The first one is depressed mood. What I mean by depressed mood, like people who have depression, they complain about feeling sad or feeling empty, tearful, feeling down, and all of that we call this depressed mood. The second symptom is loss of interest. People who are depressed, they lose interest in almost all activity. They lose interest in sports, they lose interest in watching TV, hanging out with friends, Facebook, they lose interest in everything. Nothing can make them feel pleasure. And this is one of the symptoms also. Also change in appetite and the change in sleep. Change in appetite, some people who have depression, they have more appetite. Some people who have depression, they have less appetite. So increase in appetite or decrease in appetite, this could be also a symptom of depression. Also sleep, increase in sleep or decrease in sleep, this also could be a sign of depression. So for example, when people have a decrease in sleep, we call this insomnia, and there are many types of insomnia. One is called initial insomnia or middle insomnia or terminal insomnia. So when people become depressed, some of them will have initial insomnia. This means they cannot initiate sleep. They have difficulty in initiating sleep. Some of them have, like people with depression, they have terminal insomnia. This means they wake up early in the morning, maybe they wake up at 3 a.m. or 4 a.m. and they cannot go to sleep after that. Some people have middle insomnia. And the middle insomnia means you have interrupted sleep. So you wake up like 3 or 4 different times while you are asleep. So as I told you, there are 9 symptoms of depression. And the main purpose for this presentation is to be able to identify the symptoms of depression. I don't want you to give diagnosis to our client or our guest. I just want you to be able to identify the symptom, then refer people. Okay, because to make a diagnosis of depression, it is not just symptom, it needs a lot of training and a lot of experience, but we are giving you this kind of information so you can identify these symptoms with our clients. So symptom number 5 is restlessness or slowed behavior. As I told you, depressed mood, loss of interest, change in appetite, a change in sleep, and also a change in behavior. Some people who have depression, they have restlessness and agitation, and they become more easily provoked. This could be, or some people will have slow in behavior. They move very slowly, they talk very slowly. So as I told you, the sleep might increase or decrease, the appetite might increase or decrease, also the behavior might increase or decrease. Okay, especially in elderly. In elderly, we see people more agitated, more listless. But in young adult, like between 15 and 25, people tend to be, when they have depression, they tend to be less active, feeling down, and they move slowly and they speak very slowly. One also of the symptoms is fatigue or loss of energy. Everything or any activity become very tiring. Work at school become very tiring, work at home become very tiring, because depression causes a lot of fatigability and loss of energy. Also, one of the symptoms is worthlessness and inappropriate guilt. They feel a failure, they feel that they are a loser, and they feel guilty for anything, any negative experience around them. They feel guilty about it, and they feel also worthless and helpless. Another one is decrease in concentration. People with depression, they cannot think clearly. They cannot make the right decision. Also, they have a deterioration in memory. That's why sometimes people who have deterioration in memory because of depression, we call this pseudo-dementia. It is not dementia, but we call it pseudo-dementia. This means it is not a dementia, but it looks like dementia, but it is caused mainly by depression. So deterioration of concentration and the memory and the ability to think and the plan and reasoning, all these mental capacity decrease because of depression. The last one is recurrent thoughts about death and the suicide. And sometimes people will attempt suicide or commit suicide because of depression. And this is a severe form of depression. So again, we have 9 symptoms of depression. The most important one is loss of interest and a depressed mood. And then a change in appetite, a change in sleep, and loss of energy and fatigability, also decrease in concentration, and again, recurrent thoughts of this and suicide, inappropriate guilt, and sometimes people will have a change in their activity and their behavior. Some people become restless and other people become move slowly and become more sluggish. So these are the symptoms, and this is the main thing about this presentation. This is an important slide too. Okay, I told you there are 9 symptoms of depression. You need 5 of them to get the diagnosis. But not just the symptom, you need also impairment, social impairment and functional impairment. When the symptoms lead to social dysfunction or occupational dysfunction, this is depression. But if you have just the symptom without any impairment in your life or at your work or at home, this is not depression. And this is can be applied in all mental health. If you have any symptoms, okay, which are not affecting your life socially or occupationally, so this is not a mental health issue. Mental health issue needs to impair your work, your social life, and the personal functioning. Okay, also as I told you, we have 9 symptoms, but the main ones are depressed mood and loss of interest. So if somebody has depression, I told you we need just 5, but one of these 5 should be or must be the loss of interest or depressed mood. Because if you have a change in appetite, a change in sleep, change in concentration, but without depressed mood or loss of interest, this is not depression. Okay? So we covered all the symptoms of depression. Also, I have an easy way to remember the symptom. This is see, gasp, die. This means we see people gasp before they die. This is an acronym to remember the symptom of depression. So C stands for concentration, G stands for guilt, A is appetite, S is change in sleep, P is psychomotor. Psychomotor means the motor activity. As I told you, sometimes the motor activity increase leads to restlessness. Sometimes it leads to more sluggish behavior. D stands for this, suicidal thoughts, and another D is depressed mood. Also, I stand for interest, loss of interest, and the last one is energy. And as I told you, they lose a lot of energy and they feel fatigued by any activity. So then you can remember, it is easy to remember, but if you like acronyms to remember that symptom, this would be an easy way to remember it. So as we talked, we have 9 symptoms of depression, and when you get the diagnosis, you will have a diagnosis of major depressive disorder. But sometimes people with major depressive disorder, they have some specific features, okay, or we call it types of depression. So if you have depression, some people have just the symptoms, and some other patient, they have the symptoms plus something else. So some people will have a diagnosis of major depressive disorder with psychotic feature, or with chronic feature, or with catatonic feature, or with melancholic features, or atypical features, or postpartum features, or seasonal features, or anxiety features. So that's why sometimes you find people who have depression, they have some sort of psychosis. And psychosis means that you will experience hallucination or delusions. Hallucinations mean, but this is a severe form of depression. Not everyone with depression will experience any of these. Okay, but some people will experience different types. Psychotic means you will have a hallucination, and most of the time it is auditory hallucination. This means you will hear or experience voices that no other people experience or hear. And some people will have visual hallucination, but the common one is auditory hallucination. Also delusion. Delusion means a false fixed belief. Some people will have a paranoid delusion, some people will have a delusion of grandiosity. Those are the most common one. And the delusions of paranoid means that you're going to feel that there are some people against you, or the government against you, or the mustard seed against you, or they're trying to poison you, or there are a conspiracy or plot against you. All these are types of delusion. And some people have grandiosity delusion. Grandiosity means they start to feel that they have extraordinary power, or extraordinary strength, or special talent, or they can read people's minds, or they can, or they are gods and they can create people, or they are Jesus Christ, so anything that have grandiosity feeling, we call this delusions of grandiosity. Chronic depression means depression which lasts more than 2 years. If you have multiple episodes of depression which happen over 2 years period, we call this chronic. Catatonic means depression that affect your motor activity. And this is the most common one. People who have catatonic features, they become fixed or inflexible. So you'll find people standing like this without talking, just standing for maybe 3 hours or 4 hours, not doing anything. You talk to them, or you try to move them, they are not moving, they are just fixed like that, or inflexible. And we call this catatonic, but you will not find that with our guest at the Mustard Seed, and because most of people who have catatonic depression, they are hospitalized because they need somebody to feed them and somebody to give them treatment because they cannot move. Also, we have melancholic depression. This is depression when you lose a lot of weight and when you cannot sleep. When you have a problem with sleep and you have a problem with your appetite, we call this melancholic. So I told you, some people with depression, they have more appetite. Some people have less appetite. So some scientists gather when they find people who have less appetite, less sleep, and more guilt, we call that melancholic. Atypical means the opposite. Atypical depression is a type of depression when you have more appetite, more sleep, and also more sensitivity. Those people are very sensitive to any rejection. or criticism. Postpartum depression is a depression that happens after delivery. 60% of mothers after delivery experience this problem, and some of them need antidepressant, and some of them needs hospitalization because they started to develop hallucination, delusions, and suicidal thoughts. Another one which is common in Canada is a seasonal one. This is depression that happens every certain season, especially in Canada in winter. You find a lot of people have depressive symptoms every winter. And the most important part about the seasonal depression, they respond to antidepressant, also they respond well to light therapy. There is one of the therapies that available for depression is light therapy. You are exposed to certain types of light for 30 minutes every day, and it helps people who have seasonal depression. The last one is depression with anxiety. And this is very common. You find people who have depression and at the same time they have some anxiety issues. So these are the types of depression. Another thing I want to add to the presentation, sometimes you find depression is part of another mental health problem. For example, I told you to diagnose the depression you need 5 symptoms. But sometimes people will have 3 symptoms or 4 symptoms or 2 symptoms. And you will find these symptoms is part of another problem. Like we have something called adjustment disorder. Adjustment disorder means any emotional or negative emotional change and behavioral changes that happen when you experience any stressor. Like when people experience job loss or divorce or loss of loved ones or immigration or homelessness, any stressors, and the stressor leads to emotional change or behavioral change, we call this adjustment disorder. The problem sometimes you will find some depressive symptoms is included in that adjustment disorder. Also, depressive symptom could be part of bipolar. Bipolar mean you will have 2 different episodes. You will have one episode when you are hyperactive and you have high self-esteem and inflated self-esteem and you engage in so many activities and you spend a lot of money and you are happy all the time. We call this manic stage, and all of a sudden you will switch to another stage which is depressive stage. So at the depression stage or depression episode you will experience the depression. So we don't call this depression or major depressive, we call this bipolar. When you have 2 different episodes, so that your diagnosis would be different diagnosis, which is bipolar. But if you have just depression, we call this major depressive disorder. Also, another thing is cyclothymia. Cyclothymia is a mild form of bipolar. The same as bipolar, but very mild form. Dithymia, this is a chronic depression. When you have 3 or 4 depressive symptoms for 3 years or 4 years or 5 years, it seems like your personality is very depressive. This means dithymia. So if you have some depressive symptoms for more than 2 years and it is persistent and continuous, we call this dithymia. But for major depressive episode, major depressive disorder, it is kind of episodes. You will have 2 months of depression, then you will be okay, then maybe after 1 year or 2 years, you will have another episode. This is major depressive. But if you have depression for 2-3 years continuously, this is not major depressive disorder, this is dithymia. Another one is premenstrual dysphoric disorder. This is what happened to women before menstrual period. Some women, the week before menstruation, they experience some emotional changes like anxiety, and some of them have depressive symptoms, some of them have insomnia, some of them have some obsessions or anger problem. So we call this premenstrual. Also ADHD. Sometimes you will find depression is associated with ADHD. So if we have just depression symptom, we call this major depressive disorder. If depression is part of another problem, we call this different other names like bipolar, cyclothymia, premenstrual dysphoric disorder, or ADHD. So now we're going to talk about the causes and risk factors of depression. Why depression happens. Actually, in mental health, no one can tell you one specific cause for the problem. Most of the mental health disorder happen because of a combination of factors. But the most important risk factor is the genetic factor. If you have a strong family history of depression, your parent, your grandparent, your cousins, it is very common to find depression in your family. So if you belong to this family, this means you are predisposed to depression. So genetic part is very important. Also, some scientists believe in neurotransmitter dysfunction. Like people who have depression, they have disturbance in certain chemical transmitter like serotonin or dopamine or norepinephrine. These chemical transmitters, when they disturb or when they decrease, they lead to negative symptoms, which is depressive symptom. Also, some believe in hormonal disturbance. Some scientists believe in anatomical change, like the anatomy of the brain of people with depression is different from the anatomy of people with normal feeling. But anyway, this is just one of the factors, the biological factor. If you have genetic factors or transmitter, chemical transmitter factor, also this is very important, the psychosocial factor. People who have low self-esteem, they are more predisposed to develop depression. People who have negative thinking, people who tend to catastrophize, or people who tend to self-blame themselves, they blame themselves for any negative experience. Also, any kind of negative thinking can lead to depression. Also, environmental factor, any stressor, history of abuse, physical or sexual abuse, job loss, any homelessness, any stressors could lead to development of depression. So, if somebody has a family history of depression and then start to experience multiple stressors, this might lead to or trigger the depression. Also, if you have another problem like an anxiety or addiction or eating disorder, these other disorder can at the end lead to depression. The most common one is an anxiety. If you have an anxiety and you didn't treat it well, or you didn't take the medication, or you didn't have any psychotherapy, this might lead to depression. Also, another factor is lack of intimate relationship. If you are isolated all the time, you don't have friends, you don't have a family, this could be a risk factor. Also, after delivery, this is a risk factor. Like 80% of women after delivery, they experience some depressive symptoms, but 60% of them will develop clinical depression or major depressive disorder. So postpartum is a critical period. That's why after delivery, the family doctor need to follow up with the mothers, not just the fetus, also with the family. Almost all family doctors, they ask about the fetus and they take care of the fetus. Also, they ask about the mother. How do you feel? And how do you feel about your baby? How do you feel about yourself? Because they expect that 60% of women will experience postpartum depression. As we mentioned, or any stressors could be also your personality. If you are very pessimistic, if you are obsessional, if you are self-critical, this might lead to depression too. Any negative home environment, especially at younger age. Loss of parent, if you lose one of your parents, or actually any loved ones, especially at early stage of your life, this could be a stressor. Yeah, we talked about that already. There are negative. This is a risk factor if you have negative thinking, like black and white, or self-blaming, or filtering. Filtering means there are some people who have tendency to ignore or disregard any positive experience and just focus on negative situation. So all of us, we have we experience both positive situation and the negative situation, but some people, they just filter and they focus on the negative part of life and they forget about and neglect and deny and disregard any positive experience. And we call this filtering, and the filtering can lead to depression. Also black and white thinking. You believe people are good and bad, and anything is just black and white. You cannot see the gray zone of everything. This could be a risk factor for depression too. Now we're gonna talk about how we diagnose. I told you we have 9 symptoms. If you have 5, this gives you the diagnosis. Okay, so we are learning that to be able to identify the symptom, like loss of interest, depressed mood, change in appetite, change of sleep, and the other symptoms. But when you go to the doctor and you talk about your depression and you talk about your feeling, any family doctor or psychiatrist, they need first to do some physical exam, like they examine you, they examine the chest, they examine the abdomen, they examine the heart, and they do some blood work and lab tests. Why? Because they wanna, at the diagnosis of depression at the beginning, we need to exclude or rule out these things. Because sometimes hypothyroidism leads to depression, HIV leads to depression, alcohol abuse leads to depression, MS leads to depression. If you are taking certain medication, can lead to depression. So the doctor will ask you a few questions and will do the physical exam and will do some investigation and the blood work to rule out all the organic causes or the medical causes for the depression. Once they rule out the medical causes, then they would ask you, okay, tell me, do you have loss of interest? Do you have depressed mood? Do you have loss of appetite, or do you have a change in your sleep? What about your concentration? What about guilt feeling? What about your energy? What about suicidal thoughts? They ask you about all the questions. And once they ask you and you answer all the questions with yes, 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 you will get the diagnosis of depression. So that's why you cannot just take any medication or any omega-3 or vitamin D. When you start to experience depression, you need to see a mental health professional, or you need to see your family doctor or a psychiatrist to rule out physical or organic causes for depression. Then if we rule out all this stuff, so you have just depression, and the treatment of depression is psychotherapy and antidepressant. Here is a questionnaire that we use to screen people who have some depression symptoms. Okay, if you remember the symptom, you can ask your guest about the symptom. If you don't remember the symptom, you can use this questionnaire with your guest, and if they get a very high score, this means that they have depression. And but if you know the symptom, you can just ask about the symptom. If they tell you, yes, I have a problem with sleep, again, I have a problem with my appetite, I feel depressed, I lost interest in everything, I feel fatigued about any activity, I feel guilty, I have some suicidal thoughts, some suicide or death wishes or something like that, this gives you the diagnosis, and you, at this stage, you need to refer them. So now we're going to talk about the treatment of depression. Actually, there are so many different types of treatment for depression, but the most common one is using antidepressant, which is medication, okay, and also individual therapy, which is psychotherapy. So you'll find that people who have depression, 90% of them taking antidepressant and also taking or doing psychotherapy with a counselor or mental health professional or a psychiatrist or a psychologist or just a therapist. And the most effective one is cognitive behavioral therapy. There are other types of treatment like light therapy, ECT, magnetic stimulation therapy, But these types of therapy we use as a second line or third line after we try antidepressant and the antidepressant is not working. We switch to another antidepressant. If it is not working, we switch. And sometimes we add a mood stabilizer, and sometimes we add antipsychotic, sometimes we add thyroxine. Like we try different things, and if everything is not working, we try this one, electroconvulsive therapy, which is electrical shock. But it gives a lot of improvement to people struggling with depression. So here's just examples of medication. The common one, you'll find a lot of our clients, some of them taking Cipralex, some of them take Celexa, Zoloft, Paxil, Prozac. These are common names for the antidepressant. Another people take Effexor or Prestige. Some people take Wilpetrin or Remeron. These medication, like everyone can, like we try, like we start with this one, for example. If it doesn't work, we can switch to this one or switch to this one. It depends on the patient preference, and also some of these medication have side effect. So, for example, some of them can cause GIT disturbance like gastrointestinal colic or nausea or vomiting. Some of these can cause headache. Some of these can cause blurring of vision. Some of these medication can cause sexual dysfunction and erectile dysfunction. So we try something. If the patient cannot tolerate the side effect, we can switch to another antidepressant. Also, there are some vitamins and lifestyle modification that can help when people have depression. For example, like the most important one is omega-3. Omega-3 is a very good treatment to prevent depression and also to treat. But if you have severe depression, omega-3 alone cannot help. You need antidepressant, but if we add omega-3, this will augment the action and will do some additional improvement. Also vitamin D, you can take vitamin D, but in case if you have low vitamin D level, if your family doctor will check and order vitamin D and they find the vitamin D is very low, it is important to take vitamin D because vitamin D causes a lot of depression if it is low and fatigability. Also some people use this supplement and herb. These can help St. John Wort or SAMe. But again, all this stuff for just mild depression. If you have severe depression, like clinical depression with the 5 symptoms, this means you need antidepressant, and we might add this stuff. But if you don't have depression and you have 1 symptom or 2 symptoms, you can try this stuff. Get exercise, take some omega-3, some vitamin D, also sleep well and eat healthy. Massage could be helpful for some people. Also, spirituality is very important. Relaxation technique like breathing technique is very important. Social life, also your family, your friends is very important. And take steps to control stress, like try to avoid stress as much as possible. Yeah, this is a very important point for how long we treat depression. Some people say, it is just 1 month or 2 months or something like that. No, actually, when you get the treatment, for the treatment to start working, it takes 2 weeks. And to get full response from the antidepressant, it takes sometimes 1 month or 2 months. Okay, but even when you have depression and you are taking your medication, you need to take your medication for at least 1 year. So even if you have 1 episode of depression, after 1 episode of depression, you need to take antidepressant for 1 year. But if you have more than 2 depression episodes, you might need to take your antidepressant for 2 years or sometimes up to 5 years. So the treatment of depression, it is not like abdominal colic, it is not like a headache or flu or diarrhea or anything like that. You need long-term treatment. So it could be 1 year, it could be 2 years. It depends on the features and it depends on the doctor evaluation. This is more advanced information about the guidelines that doctors use when they treat depression. We don't need to explain this complicated stuff, but I just want to show you that when doctors start with SSRI means antidepressant. When doctors start with antidepressant, they reassess you in 4 weeks, like in a month. And if there is no response, they increase the dose, optimize the dose, they increase the dose. Then they assess you again between 4 and 8 weeks, like in 2 or 3 months. Then if there is no response, they switch to another medication. So I want to show you, it might take up to 3 months. You are trying to find the best treatment for your depression. So if you went to your doctor and he prescribed something and it is not working for the first week or 2 weeks, no, you need to go and visit your doctor for another visit and ask him, oh, it is not working, I need another one, or I need a switch, I need some augmentation on this other medication, because it might take 3 months. So I'm saying that because some of our guests, they avoid, or they say they stop taking the medication and they say it doesn't work for me, I tried it for 3 weeks and no improvement. No, I'm telling you, it might take 3 months to get some improvement. Yeah, this is we talked about that already. The side effect, there are some side effects of antidepressant, some of them cause fatigue, weight loss, insomnia, but again, not everyone will have these side effects. It is a trial and error. The doctor will try the medication. If it causes side effects, the doctor will stop the medication, give you another one until you find the best medication that works for you. Yeah, this is our last presentation, last slide. I told you the best treatment for depression is antidepressant and psychotherapy. Okay? But in severe cases, sometimes you need hospitalization. If you have severe suicidal thoughts and you are not able to take care of yourself, you need hospitalization. And I told you, sometimes in severe cases when people are not responding well to antidepressant, sometimes we need to use ECT, which is electroconvulsive therapy, or we use transcranial magnetic stimulation, but we don't use this as a first line. We use this after we try different antidepressants. This is a lady who is taking the electroconvulsive therapy. I want to reassure you that this therapy is not painful at all, because it is like a surgery. You get some anesthesia and you get some muscle relaxant. You don't feel anything, and they do the therapy. The therapy is just about 30 seconds or 40 seconds, and it helps the electrical activity or electrical shock. It helps and improves the depressive symptom. And this one is the transcranial magnetic stimulation. This one also, it is not painful at all. You do the session for a few weeks, and then it shows some improvement. This is just a reminder for people who are working with us at the Mustard Seed. We have 3 counselors at the Mustard Seed. So I work closely with employment. So if you have a guest who is who work in employment and have any mental health issue, you can refer them to me. If you have a guest that working in housing program and part of aftercare program, you can refer them to Carrie, and she will take care of the assessment, take care of the referral. Also, if you have a guest who is working in ARCH program, you can refer them to Porus, and he will take care of the mental health or addiction problem. Thank you.